or fundamentals of nursing. So in that also, especially you who are studying in a semester wise batch, so for that students it is going to be very useful. Not only for that batch, you can study in any nursing courses. This is one of the basic subject to know each and everything to excellence in the journey of your nursing. So for that reason, today I'm gonna conduct you regarding the units like unit number 6 and like 5th and 6th we are going to conduct. In that also, basically, so we are going to study regarding documentation and reporting, and the next thing vital sciences. So these are the two units which is comes under the semester. Okay, so where we are going to study in the first semester BSc nursing, these two units are very important, and in this live session today we are going to discuss on this particular two units, and hope this will going to be very useful for your exams and as well as for your knowledge also. Okay, you will gain the knowledge after attending this live session. So watch this session completely, and if you are new to our channel, please do subscribe, and we can go with the first unit number 5. So the unit number 5, you can see that the documentation and reporting. When it comes to the documentation and reporting, these are the two concepts are very important in our nursing. Okay, so whatever you are doing, whatever the work you will do, you have to document. Okay, so the documentation is one of the very essential part of the nursing. Okay, so the documentation purpose of reports and records we are going to study in this, and confidentiality. So this is one of the very important terminology and as well as the topic. Later we can discuss about this also. And the types of client records, what kind of records will be there. So what are the types of records we are going to discuss, and methods or system of documentation or recording, how you need to do the documentation, what are the methods we are using. So that is also one of the essential part, and the guidelines for documentation. So the guidelines also we are going to see in this particular unit. Do and don'ts of documentation or legal guidelines for documentation or recording. Okay, so these are very important to know. And reporting changes of shift reports, transfer reports or incident reports. Based on the reports, the certain changes will be there. So those changes we are going to be study in this particular unit. So without wasting time, we are dive into our topics. The first one is documentation and the purpose of reports and records. Documentation refers to, it is one of the systematic collection, organization and maintenance of written or electronic records, reports and other materials that provide evidence of activity and as well as events or decisions. Okay, so these are the main things you should know better to understand what it is the documentation. Okay, so documentation refers, it is one of the systematic process, or systematically we are going to collect and organize and maintenance of written or it may be electronic. Nowadays everywhere you go and see, in the hospital also, e-documentation. E-documentation means what? Electronic. We are using digital documentation for each and every work. Suppose you want to administering any kind of medications, or you want to order the medication from the pharmacy for the particular patient, whatever it may be. So everything which is going to be taken care by the computers. Okay, so digitally we are going to work. So there how we are going to be work in orderly, systematically collecting and maintaining all those records and reports. So that we will known as a documentation. Okay, so the materials provide evidence of activities. So those documents which are going to provide evidence for your activities or events or certain decisions. Okay, so later in this particular unit only we are going to discuss about the types of, by the time we are going to take a consent. So that is very important, okay. If any kind of complications will be happen, you have the documentation to show yourself, and that will make sure you to be safe from other complications in your career, okay. So for that reason, before the operation or the surgery, we used to take a consent from the patient and the family members, okay. So for example, I'm telling same like this only, it is one of the systematic process and collection of the data and keeping the records for our evidence of the activity or the events is known as documentation. So now we can see the purpose of reports. Why we need to do this documentation? Let us know this one. Communicate information, okay. For example, one person is having morning shift, another person is having night shift. By the time you have to communicate, okay. So you can't able to call and tell that this is the thing. You see, while giving the charge, once you can tell, again and again you able to tell, it is not possible. So for that reason, to communicate the information, document events or activities, whatever the activities which is taken by you, you have to document, okay. So the next one, analyze the data or the situations, okay. So you have to analyze the data or situations. And next one, support decision making, ensure accountability. So you have this documentation which is going to be supports your decision making, okay, which is going to be helpful in the autonomy, okay. So while taking the decisions and all for the further care, so by the time while you have to take the decision means you have the records and reports, okay. So for that purpose you have to do the reports, you have to do the documentation. That is all about the purpose. Next we can move towards that store information for future references, okay. So for future, okay, for example, not only one kind of documentation, death certificates, birth certificates, and all, it will going to be keep on asking for any kind of legal work, okay. Same like that only, to claim some insurance and all, you, if you want after the care, you want to claim the reimbursement of your money, by the time documentation is needed, okay. So certain things are very important. The next one, provide evidence or proof, okay. So in any kind of complications, you have to provide the evidence for your care and all. So by the time this will be acts as a proof, okay. The next one is support continuity and consistency and facilitate audits or reviews, okay. So these are the purpose we have to, through this documentation and reports, we have to do that. So the next one is confidentiality. The confidentiality is one of the very important topic. So this one I will give you the example. Listen students, when it comes to this confidentiality, confidentiality means keeping a sensitive information private and secure, only sharing it with authorized individuals or parties. It's about respecting people's trust and protecting their personal or sensitive data. See, this word, it is one of the sensitive word, okay. So we should not going to share all the things in front of everybody, okay. Certain things we have to be keep secret, and we have to secure the data. We should not go and enclose in front of other people irrespective of the authorized person. So confidentiality is nothing but we have to be that secret or privately we have to keep it maintained for our or the authorized person's sensitivity to we should not lose their personal things in front of any other person, okay. So to secure their personal security and privacy and all, in order to maintain that one, we have to maintain the confidentiality, okay. So types of client records, common record keeping forms, okay. So what kind of client records will be there? Here the client refers to the, this client refers to the patients. First one is medical record. Okay, so before going to dive into these types, I will tell you, in the hospital all of you know that a like one of the biggest department also will be there, that is what MRD, medical records department. So there are lots of records you have to be hand over all over the things. We already know the purpose, so at least we have to like you have to know, maintain the record properly for at least audit and review purpose also, right? So that kind of things also we have to maintain. So for certain maintaining particular records and documentation, a certain department will be there, that we will call it as a MRD, medical record department. The next one is the first type. Okay, so this one is medical records. So medical records are the patient history we used to take regarding all about the condition of the patient, and their biodata, diagnosis and treatment plan, medications, whatever the doctor has been informed and what you have administered, what are the diagnosis will be there. See, if you go and seeing, you can scan the patient. No, it is not possible. You people are not robots. We are not robots, right? So for that reason, as a nursing student, what you will do, you have to go, you will first open the file and you will see that, okay, what is the thing which is there. So by the time you can able to understand the diagnosis of the patient or the client by seeing the chief complaints, whatever the doctor has been written in the admission file. Okay, so this is also very important. The next thing is that you can see here financial records. So this is all about regarding your payments, and the meanwhile you can see that you can able to know which is, so you can see able to know about this financial records like invoices, payments and billing info. Okay, so very important. When it comes to hospital, we have certain financial things also for taking medications. Admission will be there, means you have to pay lots of bills will be there. So for that and all, for insurance which is all there, means you have to submit those bills, then only you will get the reimbursement and all of the money. So that is also one of the important. And the next thing, progress notes. So session notes, treatment updates and client progress, which is like from one shift to another shift, working professional, we have to communicate through our notes. Okay, so that is also one of the very important. And assessment forms. Okay, so initial assessment, whatever the initial assessment you have done, so all those things you have to go through this initial assessment forms, like assessment forms and intake forms, evaluations. Okay, intake output chart will be there when it comes to this assessment forms. Next we can see that consonant forms. Okay, so consonant forms are informed consent. This is one of the very important word which we are going to listen every time in our career. Okay, so as a nurse we should follow this consent forms every time. Be carefully before going to do any procedure or before going to do any kind of crucial procedure like surgery and all. Without skipping this step, we should take the consent forms. So the consent forms are informed consent, treatment agreements which is there. Okay, you have to inform to the patient. So this is the surgery, it is there like this, and you have to inform to your patient as well as the family members of the patient. Okay, so that is very important. So after that you have to take the signature for the consent form. The next one is confidentiality agreements, the privacy policies and non-disclosure agreements. The confidentiality means what? You know that the confidentiality means keeping secret of somebody else private things or the sensible topics or the what we can say. Okay, making see, this is all about confidentiality agreements means we are going to supposed to know about the like we should not going to disclosure in front of anybody else. We are going to be secure the things which is very confidential, secretly we are going to maintain, and we should not tell in front of all the people. We can only discuss in front of the authorized person. We should not disclosure the authorized person information or the data towards another people. Okay, so this is all about this one. Then common record keeping forms include like intake forms, consent forms, intake forms, consent forms, treatment plans, progress notes, templates, billing, invoices. Okay, so if you take one file of the patient, this much should be there. Okay, initially what it was, see, we have seen the intake and output charts will be there. To record the vital sign chart will be there, and to administer the medications, doctor's order will be there. Okay, so and after that we will have the certain chart to mention the all the medications. Okay, so there we are going to supposed to maintain whether you are administer or not. See, if you are administer means you have to write the proper timing and you have to put the signature of yours. So that is one of the role of the nurse. Okay, so this is all about the common record keeping record keeping forms are included in the documentation. Okay, so still now we have discussed about the various types of records. Okay, so types of documentation we have discussed. Now we can move with the methods or systems of documentation or recording. Okay, so how we are going to be follow certain methods, how we need to do. Okay, so some methodology is needed. Whatever you will do, certain methods we used to use. Okay, if you want to conduct the research, certain methods we need to follow. So same like that here also, for maintaining the documentation we are going to learn few methods and the system of documentation or recording. Okay, so the paper based records. Okay, the first method is paper based records. It is a traditional files or charts, notebooks. Okay, so if you can go like abroad like Germany and all, still there is a lots of documentation work still ongoing process. Okay, so they are using lots of like what we can tell, traditional files. Okay, the files will they are literally they are now also they are doing in a manual way. Okay, so that kind of things we can see in the paper based. Okay, in Germany, for example I'm telling what I have heard in Germany and all, that they are using still paper works are more. Okay, so same like that, this is the first method, paper based records. So it is like a traditional files. The second one is electronic health records, that e-health records what we are calling. Those are like digital patient records often used in healthcare. Okay, everything should be recorded digitally. Okay, by using the computers and all, we used to record the patient's data. Then digital note taking apps, for example Evernote, OneNote for quick notes. Okay, so these kind of apps we can use for the notes and all, you can see in your phone also. The next one is spreadsheets. Okay, for tracking data, finances or client info we are using the spreadsheets. Okay, so that is also one of the methods. The next one is specialized software like practice management software for the therapist or medical professionals. So for example I have seen that MedHigh. Okay, so MedZ, like this kind of professional software we used to use to keep the patient's records and as well as to do the billing. If you go and do that any kind of lab reports you want to take and all, so everything should be like in a such a like a digital way only. So they used to use certain softwares. Okay, so because of that, in order to like we can give a quality care as well as we can give a quick easy care for the patients. We can't able to lose the time and patience of the patients. Okay, so that is one of the advantage of this also. So by using the softwares, then audio video recording for sessions, interviews or meetings with consent. Okay, so these are also one of the records which we can see. Okay, so for with the consent we can see that video and audio visual like things we can use to maintain the records. So these are the methods. Next one is we can go with the guidelines for the documentation. Be accurate and truthful. Okay, so the record should not be manipulated. Okay, so you have to record how much you are recording the blood pressure. You have to write it down the same blood pressure. You should not write another thing. For example, I am telling. But the thing is that be accurate and truthful. Records facts, not assumption or opinions. Okay, so we should not able to assumption something else. We are thinking something and we are writing, it is not possible. Okay, always we have to maintain the accuracy while writing the or maintaining the documentation. Then be timely. Document events as soon as possible after they occur. Okay, once see let them come after we can write. It should not be like that. Once they are coming, you have to immediately do the documentation. The next one is be clear and concise. Okay, use a simple language, avoid jargon. Okay, so you should not use like big sentences and all. It should be very minimalistic way. The next one we can go with that, use proper grammar and spelling. Okay, so use proper grammar and the spelling to ensure the professionalism. Okay, instead of write like some people used to write wrong spellings and all, so you should not do such kind of things. You have to use the proper spellings and all. The next one, maintain confidentiality. Again, to protect the sensitive information and all, you should not give your records to somebody else to see. Okay, so that for whomever it is will come and wants to see, wherever you have to maintain the sensitivity, wherever you want to maintain the privacy and the confidentiality of the data, you should not disclosure in front of anybody else except the authorized person. Next one, use authorized abbreviations. Only use approved abbreviations. Sign and date entries. Verify authenticity. Keep it organized. Use a systematic approach. Okay, it should not be like something else you are putting and you are keeping somewhere. It should not be like that. You have to follow all these guidance to maintain a proper documentation. So next we can move with next slide. So do and don'ts of documentation. So what you are going to supposed to do and what you should not do. Okay, so that is very important. Legal guidelines for the documentation or recording. Do in the sense like what you have to do, document everything. Okay, so everything you should document. You should not be like something else you are doing and you should not writing in the documents. It is not good. You have to record everything. Okay, record all relevant information, decisions and actions whichever you are taken during the care. Be accurate and truthful. Again, so you are to write the facts what you are going to be saw. Okay, are correct and unbiased. Should not be used any kind of biased thing, not manipulative things. There is no place for those kind of things. Okay, to avoid the error. The next one, get consent. Okay, whatever, obtain informed consent before recording or sharing information. If you are going to share any kind of information and if you are going to be do the any kind of procedure, you have to obtain a informed consent. Okay, so that is what do's. You have to do that. Then maintain confidentiality, protect the sensitivity. Again, I am telling you should not disclosure in front of anybody else. Okay, so this is one of the important thing. Then follow, organize. Okay, so you have to follow the organization of the documentation. Okay, so these are all about the do's. Okay, so before going to saw the don'ts, all are, I think, waiting for the result. So what about your result and all? Are you expecting? What is your so everybody is like waiting for the result, especially you all are completed your UG, already MSc result came. For BSc result only we are waiting, so all of you are expecting the result. So the result will be near only. Still few papers are left maybe. So for that reason, quite delay is happening. But for sure in the next week and all, we will definitely get the result. They will not going to be do much more delays. So that is also one of the benefit for you guys. You can't able to wait for so much of time, so that is so next thing we can expect, like next week onwards we can expect the result. So next we can do the follow organizational policies and adhere to workplace documentation and guidelines. Okay, whatever the guidelines which is given by the authority or the organization or the institution, so you have to follow that. You should not do by yourself. Okay, so everything should be guided by your institution. According to their guidelines, you have to go through the documentation. You should not use your own rules and regulations over there. Okay, so next we can go with the don't. Okay, so what you should not do, that we can see now. Don't falsify records, which means never alter or manipulate the records or the reports of the data or the information. Okay, then don't share confidential info without consent or authorization. You should not going to be share the consent. Okay, the next one, don't record irrelevant info. Okay, you should not record the irrelevant info. Should not going to be tell false things in the documentation. Whatever the accurate things which is there, that only you're going to tell there. Okay, so stick to the facts relevant to the case or the situation. That's what they are telling. Stick to the fact. Okay, you should not going to be manipulate over there something. See, there some small what we can ring some worms used to go. If you are telling snake is going, means it is good? No. So same like that only, you have to like stick to the fact. You should not going to tell any kind of wrong things. Don't delay documentation, record events or any things as soon as possible. Don't waste your time. Okay, not your time. Once you receive the case, you should not like waste the time. So for that reason, you should not delay. Okay, the next one, don't use jargon or abbreviations unless widely accepted in your field. Okay, suppose patient, we are writing PT, that is accepted. Okay, with some mnemonics, like some kind of symbols we used to use. See, like this and all we are using, no? So these are the things which makes us that we can see for patient and we used to write like this PT, that can be accepted. But when it comes to other abbreviations or jargons we are using, by the time it is not good. While writing in your examination also, should not write patient or something else like PT with that and no, it should not be like that. Or some abbreviations will be there. Okay, WHO, Don't write like that. Write fully World Health Organization. So this is the form we should use. Okay. So these are the things you should avoid. Then legal guidelines, Data Protection Act and informed consent, professional regulations, evidence handling. Okay. So Data Protection Act comply with the laws protecting personal data. You should not going to be enclose the protection personal data in front of other person. Then obtain consent. Okay, so that and all we already discussed. Then obtain consent before recording or sharing any kind of information. Same things. Professional regulations, follow industry specific guidelines, for example medical legal. Okay. The next one, evidence handling, handle records and as potential evidence in legal proceedings. Okay, so some kinds of cases will be there in our medical legal cases also will be there. So for that time you have to protect your documentation properly and maintain those things in a proper way. That will make sure you to get good result in the future. Otherwise it maybe leads to stuck in some situations. So for that reason you have to maintain properly. So hope you guys are understood this one. Next we can move towards 7th slide, reporting changes of shift reports, transfer reports, incident reports. Okay, so this is what reporting, like for reporting something else to for somebody else. Okay, so we are going to report to the another person or another worker by the time whatever the change, change of shift reports will be there, the transfer reports will be there, and incident reports will be there. Okay, first one we can see with the change of shift reports. Okay, first hand over info to the next staff member. Okay, info in the sense wherever the info will come here. So the info will come here now. So these are all like that data information. Okay, so hand over the info into the next staff member, cover important events, task and client status, ensure the continuity. Okay, continuity of the care. Okay, whatever the things which is there you have to going to be informed to your other staff member, next shift staff member. That is all about the change of shift reports. Okay, the next one is transfer, documentation, client transfer details whenever shifting from one hospital to another hospital will be there, include relevant history, current status and the care plans. And we are going to write that facility smooth transition to the new location or team. Okay, so for example I said from one hospital to another hospital we are transferring, we are shifting the patient. Okay, by the time this transfer reports is going to be take a part in major. Okay, so the next one is incident reports. Okay, when it comes to the incident report, document unexpected events or accidents. Okay, incident means the scenario or the accidents. Okay, so incidents we are going to be document and include the facts, actions taken and follow up plans, support investigations and future prevention. Okay, so any kind of investigations which is going to be supported to maintain this incident reports. Okay, so these are all the reporting. Okay, these three are clear. Next we can move with unit number 6. Okay, so before going to that unit number 6, we will discuss one recap of this unit number 5. Okay, so documentation and the reporting is one of the very important. They are acts as a two faces of the same coin. So you have to ensure your clarity in report writing, and clarity should have in every kind of that documenting part. Okay, and confidentiality is also we have studied in this particular unit. as of now we know that what to do and all. Okay, even though we are having a highly digital knowledge we have, but even though sometimes some biased things which can be occur, so in order to control that you have to follow what you have to do and what you should not do, that guidelines, legal guidelines and all you should follow while doing the documenting and all. And first and foremost thing, my dear students, for like handling of documentation is one of the biggest task. So you should not maintain in a bad manner or dirty way. You should be, everything should be well organized, and you have to be follow the organization of documentation very carefully. So because in order to spoil the documentation or any kind of reports, so that will make sure going to cause any kind of complications for the patient health also. Okay, so whatever the things, while transfer reports and all, by the time you have to accurately providing the data to continue the further care from another team members or another hospital. Okay, by the time they should not also feel confused. So if they are confusing, there may be a changes in the care. Okay, so by the time patient will going to be suffer. So for that, in order to curb all these factors, you have to mainly focus on this particular wonderful chapter that we have studied today. Okay, so documentation and reporting. Okay, next we can move with the vital signs. So all of you know that what are vital signs. Vital means what? Okay, so the vital means important. Okay, so in small way I have written here, vitals means important. So the vital signs are include that temperature, blood pressure, pulse rate and SpO2. This and all we have already studied. Okay, in this particular class gently we are going to glance the things which is related to the vital signs. In depth we need to take, means it is all around so much of time it's need. Okay, but in particular unit we can see the glance of the vital signs, and then after later on course in our YouTube channel only we are going to be take a class. So we are going to be take a class particular one individual vital signs. Okay, so the body temperature, the first one we will go with the body temperature. There also body temperature, pulse. Okay, so how to assess the pulse, how to assess the body temperature, site, equipments we are using, the techniques, everything we are going to study in this particular. Next we can pick it. Pause. Voice will come. So the respiration, blood pressure and how to document the vital signs we are going to study in this particular unit. Okay, so now we can see one by one. Okay, so before going to see all the vital signs, certain guidelines are there for taking the vital signs. So first one is prepare the client. Okay, so you have to, whatever you are doing in front of the patient in nursing, you have to go and introduce yourself, and you have to going to be tell to the person, this is the thing I am going, okay, so that is what you are going to explain the procedure, okay, so that is also very important. Then prepare the client, that is what, explain the procedure, ensure they are comfortable and relaxed, okay, so you have to ensure that use a proper equipment, okay, so if you are going to check this temperature by using the sphygmomanometer, this is never possible, okay, so for that reason you have to use a proper equipment for the proper vital signs checking, okay, so that is also one of the guidelines. And follow standard techniques, for example BP, correct the cuff size, arms position and measuring technique. Then pulse, count for 1 full minute, okay, you should not manipulate in this. And respiration, observe chest rise and fall, okay, while taking the count of the respiration you have to observe the chest rise and fall. Then temperature, follow the device instructions, okay, so record accurately whatever the things you are going to record in vital signs, you have to record it accurately, you should not be biased, okay. Report abnormal results, inform the relevant healthcare professionals if any kind of abnormal results, which means there is a certain deviation in comparatively to the normal range of vital signs, by the time you have to inform to the healthcare professional, okay, authorized healthcare or relevant healthcare professional. Now we can see that body temperature, okay, one by one we can move. So the body temperature is that the body temperature is one of the, what we will call body temperature, okay, so the difference between the our body temperature, right, and the atmosphere, okay, so that's what here the temperature is measures of the body thermal energy typically measured in degrees or the Celsius Fahrenheit, okay, so the hypothalamus, the brain regulates the body temperature, balancing the heat production and the loss, okay, so the difference between the production of the heat produced by the body and the loss by the body, okay, so that is what the body temperature, okay, so this one we are going to be measure in the Celsius, degree Celsius, or as well as in the Fahrenheit, okay, so the next one is equipments to measure the body temperature. We are going to use the equipments like digital thermometers, the oral, rectal and ear thermometers will be there, and the next one is infrared thermometers. The next we have seen the mercury thermometers, less common now, but we are like in nowadays also we are using those kind of things. The technique, choose the right site and equipment, follow the device instructions which is given in the device, and ensure the client is calm and comfortable, explain the procedure to the client, and as well as the place thermometer correctly under the tongue for the oral, okay, so if you are checking in the orally thermometer, you have to use in a proper way, means you have to keep the thermometer orally, okay, nowadays we are using the digital thermometers. So for example that forehead infrared thermometers we used to, like we are going to be hold like this and checking the thermometer, like temperature of the person. Next one is you have to wait for the reading to stabilize, okay, should not if you are using a manual thermometers with like mercury, you have to wait for a while, okay, so after that only you have to take the readings of the thermometer. Temperature alterations, hypothermia, cramps, heat exhaustions, heat stroke, hypothermia, okay, so hyperthermia, hyper means increased level of temperature, okay, elevated body temperature can lead to heat related illness. Then heat cramps, okay, when it comes to the heat cramps, the muscle spasm due to dehydration and electrolyte imbalance, okay, due to the dehydration and the electrolyte imbalance in the body leads to the muscle spasm, okay, that may leads to the heat cramps in our body. Okay, so these are all the things. For example, I can say that when during the woman reaches to the menopausal time, by the time the women are experiencing most of the time this heat cramps. Okay, so the next one is heat exhaustion. Severe dehydration symptom include dizziness, nausea, headache. By the time you can see that heat exhaustion and the heat stroke. Life threatening body temperature will be 40 degrees Celsius or more than 104 degree Fahrenheit. Symptoms include like confusion or seizure. By the time we can see that heat stroke. Okay, so the next one is hypothermia. Hypo, there is a difference between the hyperthermia and the hypothermia. Hyper means the elevated body temperature, which means increased body temperature. When it comes to the hypothermia means the low body temperature, which is less than 35 degrees Celsius or 95 degree Fahrenheit. Okay, the symptoms include like shivering and confusion, which we can see, or drowsiness will be there. Okay, so when it comes to the hypothermia. Okay, next we can see that fever or pyrexia. So fever means we already know that it is an elevated body temperature more than 38 degree Celsius or 100 degree Fahrenheit, 100.4 degree Fahrenheit we will call it as a fever due to the reset of the hypothalamic thermostat. Okay, so increasing in the body temperature, which is going to be called as a fever when it comes to the range of more than 38 degrees Celsius or 100.4 degree Fahrenheit. Next causes like infection. Most of the time we are getting the like fever or the pyrexia due to the infection like bacterial infection, viral infection, fungal infection, inflammatory conditions like arthritis, malignancies, and due to some kinds of medication side effects and all, we used to get this the elevation of the body temperature. Then stages, the onset, okay, so the onset, the chill phase, the body temperature lightly rises. After that, febrile phase. Okay, so second one is febrile, high temperature sustained in the body. The next one we can see that defervences. So the flush phase, temperature drops. Okay, so there it is going to be drop the temperature. Next we can see the types of temperature. So the low grade, moderate, high grade. Okay, so three grades are there: low grade, moderate and high grade. So the low grade means 37.5 degrees Celsius to 38. Next one, moderate means 38.6 degrees Celsius to 39.5 degrees Celsius. High means that more than 39. Okay, so more than 103 Fahrenheit degree. If you are converting in the Fahrenheit, we are getting that one. So these are all the things are very important. So for nursing management to control the pyrexia and all, so this already we know that assess, monitor the vital signs like temperature, taking a vital part in here to maintain the pyrexia fever in the patient, identify underlying cause, evaluate the symptoms and discomfort. Interventions, you have to administer the antipyretics like paracetamol as prescribed by the physician. Okay, so the next one is use cooling measures. Okay, in order to reduce the temperature, we are using like a tippet sponge bath and all used to give, right? So that one you have to encourage fluids and rest, encourage the patient to take more fluids and all, and monitor the complication, for example dehydration, seizure. Education, explain cause and management of the fever and advise on when to seek medical help, promote hydration and comfort measures. Okay, so these are the management we should follow. Hot and cold application, you already know that. Increase the blood flow to reduce the pain and stiffness. Uses like muscle spasm, menstrual cramps or wound healing. So these are most of the time, if any kind of pain will be there, menstrual pain and all, by the time you used to use the hot water bag and all to reduce those pains. So there, which is going to be very helpful. The next one is cold applications like to reduce the inflammation, numb pain and any kind of swelling will be there. Suppose if you are putting cannula, by the time we can see the most of the time swelling we can see in the wrist and all, by the time we used to advise the patient to apply the ice pack. Okay, so to reduce the numbness or the pain in the particular area. Okay, then uses like injury, post-operative swelling, headaches. For example, ice packs, cold compressors, cryotherapy we are using during during the cold application. Okay, so that is the difference between the hot application and the cold application. Now we can see the pulse. Okay, the second vital signs is pulse. So in vital signs, along with pulse, respiration, temperature, SpO2, oxygen saturation, and as well as the blood pressure, we have one more is pain. Okay, the fifth vital signs is pain. So later we can discuss about that. Definition is the pulse is the rhythmic expansion of the contraction of artery as blood flows through it. Okay, so it is a rhythmic contraction or the expansion of the artery as the blood flows through it. Okay, the physiology and regulations generated by the heart's contraction. Okay, when it comes to the heart will be contracted, by the time it is going to be generated, regulated by the atomic nervous system, ANS. Okay, the sympathetic and parasympathetic nervous system, and influenced by the factors like blood volume, pressure, and vessel elasticity. Now we can see the characteristics, the rate. We are going to be going to calculate beats per minute. Okay, so what is the normal pulse rate? If you know, means please do comment down. And rhythm, regular or irregular rhythm will be there, we used to know. The next one is volume, the strength or the amplitude we are going to see. And tension, atrial wall pressure we are going to see by assessing the pulse. Okay, so these are the characteristics you should know. Then factors affecting the pulses: age, fitness level, emotions. Okay, so the emotions you have to see, and medications, body position, and fever, illness or infection or dehydration. By the time there may be slight changes we can see according to age also. Okay, so older people means they are having a slight deviation, and when it comes to the babies, they are having a, for comparing to the normal adult, they are having more pulse rate. Okay, so same like this, certain factors are going to be affecting the pulse rate. Okay, the next one is the normal adult pulse rate is all about, I told you to comment it down. If you are commenting, that is well and good, otherwise you should know that 60 to 100 beats per minute. Okay, so the next one is respiration. The respiration is also one of the important vital signs. The respiration is the process of gas exchange, O2 and CO2, oxygen and carbon dioxide, between the body and the environment. Okay, so it is one of the gaseous exchange between the body and the environment. That is what which is present, like oxygen and the carbon dioxide. Okay, we can see the physiology and regulations. So here you can see controlled by the brain's respiratory centers like medulla and the pons, regulated by the factors like blood, pH, O2 and carbon dioxide levels, involves the diaphragm, intercostal muscle and the lungs. These are the physiology which is included in the respiration. The next one, mechanics of the breathing, inspiration and expiration. Inspiration means inhalation of the air, which is O2. Diaphragm contracts and chest expands. Okay, so that is what inspiration. Okay, expiration means, or the exhalation, diaphragm relaxes, chest recoils. Okay, so that is how we need to assess the respiration. Okay, the characteristics, the rate. Okay, the breaths per minute. Okay, so we are going to use breaths per minute. Pulse, beats per minute. Don't be confused. Pulse is beats per minute. Respiration is breaths per minute. Then depth, tidal volume we are going to see, and rhythm, regular or irregular, efforts, labored or easy. Okay, the person is like efforting to take a breath. Okay, putting effort to take the breath, that we are going to see in the characteristics. Okay, so next is factors affecting the respiration: age, fitness level, emotions, body position, medications, lung diseases, for example COPD, okay, chronic obstructive pulmonary disorder, or asthma. By the time the respiration rate will be, we can see the deviation in that, okay. So these are all the factors will going to be affect the normal respiration. For normal adult, it's about 12 to 20 is the normal respiration rate, 12 to 20 breaths per minute, okay. Then assessment, observation of the child, like chest rise and fall, we can see, and rate, depth and rhythm, and use of accessory muscles. Count how we are taking that breaths per minute. Normally it is all about 12 to 20 breaths per minute. Count for 30 seconds and multiply by 2, okay. You have to count for 30 seconds and you have to multiply it by 2, then you will get the proper value. Next we can see assess, okay. So the pattern, the regular or irregular, depth or shallow, effort, okay. So easily the person can be able to respirate, or the person is putting the effort to respirate, that we have to see. The note, any abnormal sounds like wheezing or stridor will be there, okay. So you have to see the abnormal sounds, okay. So if you are having any kind of asthma and all, by the time there is a sound will come from while respirating, okay, while respiration, okay. So you have to observe for that, okay. Skin color and oxygen saturation you have to thoroughly check, okay. The next one is atrial oxygen saturation. Atrial oxygen saturation, SaO2, measures the percentage of hemoglobin binding sites occupied by oxygen in the atrial blood, okay. So in the atrial blood, oxygen which is present and that should be occupied by the oxygen in the atrial blood, there is a binding of the hemoglobin will be there. Normal range, it's all about 95 to 100% measured by pulse oximetry, that is what SpO2, the atrial blood gas or ABG analysis we used to do, and we are going to do this. Indicates oxygenation status and effectiveness of the gaseous exchange in the lung. Then factors affecting altitude, lung function, hemoglobin levels, cardiac output, okay. So the next thing is we can see the alteration in respiration, okay. So tachypnea. Tachypnea means a rapid breathing which is more than 20 breaths, okay. Bradypnea, the slow breathing, okay, which is less than 12, okay. Then hyperventilation. Hyperventilation means increased rate and depth, okay. And hyperventilation, hyper means increase, hyper means decrease. Apnea, what is apnea? Temporary cessation of breathing, okay. Temporary cessation of the breathing, loss of the breathing. Then dyspnea. Dyspnea means difficulty in breathing. Orthopnea. Orthopnea means difficulty breathing while lying flat, okay. So that is what orthopnea. This is very important. Sometime they used to ask during the viva and all. Then knee breathing. So knee breathing means labored breathing using accessory muscles, okay. So these are all the things. Then next one is blood pressure. When it comes to the blood pressure, so the blood pressure is a force exerted by the blood on vessel walls as it circulates. Physiology we can see generated by the heart contraction, systole, and exhalation, diastole, okay. By the time we are going to be check the BP, then according to that we are going to take the reading. Regulated by nervous system, kidneys, hormones, for example RASs. Then influenced by factors like cardiac output, blood volume, and vessel resistance. Next we can see characteristics. Systolic pressure means peak pressure during the systole by the time contracted. Diastolic pressure means the pressure during the diastole, okay. So here you can see that one, okay. So generated by the heart's contracted. Contracted means systolic. Then relaxation means diastole. Okay, so now we can see that here the systolic pressure means peak pressure by during the contraction. The next one is diastolic pressure, means the pressure when the heart is relaxating. Okay, then pulse pressure, difference between the systolic and the diastolic we will call it as a pulse pressure. Okay, so the next one is factors affecting the BP. Again, this age, genetics, diet, high salt and high potassium will be going to increase the blood pressure. Then stress, medications, medical conditions like kidney disease or obesity will also leads to get the hypertension, which is high blood pressure. Due to the high blood pressure only we are getting. The normal BP is 120 by 80. Okay, so less than 120 by 80 is also normal only. So the normal BP is 120 by 80. So the assessment of sites, equipments and technique, common errors in the BP assessment, what it will be there means the brachial artery is the most common artery we are going to check the BP, then radial artery, and we are going to see that popliteal artery. Okay, so the next one equipment, which is sphygmomanometer. Sphygmomanometer is the equipment. We are using both manual and the digital. Nowadays digital will be more, but you can use the manual also. The cuff will be there. Okay, so what we will call for that cuff? Corat cuff. Okay, so the cuff, the BP cuff, the name is Corat cuff. So the cuff, the correct size we should choose. Somebody else is more obese, by the time if you are using a wrong size of the cuff, you can't able to record the blood pressure. Okay, so the next one is technique. Okay, the patient seated, arm at heart level should be there, and cuff wrapped around upper arm, and inflate cuff, palpate or auscultate the pulse. Okay, so record the systolic and diastolic pressure. Okay, so you should not tie the cuff tightly or in other ways, that may going to give the wrong record. Incorrect cuff size, arm above or below heart level, like taking or moving or talking or moving during the measurement of the BP is should not be going to give the correct result. Digit preference, rounding errors will be there. Faulty equipment, fault in the equipment also going to be. Alteration in the blood pressure, hypertension, hypotension, orthostatic hypotension, white coat hypertension, malignant hypertension. Okay, so one by one we can see. Hypertension means elevated blood pressure which is recording more than 140 by 90, we will call it as the hypertension. Hypotension means low BP. Okay, it is less than 90 by 60 mm of Hg. The next one is orthostatic hypotension. Blood drops upon standing. Okay, while standing and checking the BP, by the time blood will going to be drops. That is what orthostatic hypotension. Okay, so the next one is BP drops. Blood pressure is going to be drop. Okay, by the time. Next one is white coat hypertension, elevated BP in clinical setting. While seeing the doctor itself, it is going to rise the BP. Okay, so that is what white coat hypertension we will call it as. Then malignant hypertension, severely elevated blood pressure. It's about 180 by 120 mm of Hg with organ damage. Okay, so that is what malignant. Next one is documenting vital signs. The format: temperature, pulse, respiration, BP, SpO2. In this format only we need to check the vital signs. For example, temperature, see, in order like this we have to write. Include date and time, any abnormalities or concerns, interventions. For example, O2 therapy indoor, patient position, supine and sitting position is very important while checking the blood pressure especially. So these are all the important vital signs. Okay, so today in this particular topic we are going to saw that we already seen and studied about the vital signs and as well as the documentation and the reporting. Both are one of the very important topic. If you have any doubt, in upcoming days we will do that one by one particular topic in depth. So by the time you will understand little more. And so far we have discussed about 2 units today. So for thanks for watching. If you are new to our channel, please do subscribe. Thank you so much.